Thank you, everyone. All right, Madam Clerk, this meeting is officially back from recess. If you could please call the roll.
Commissioner Gill,
Present.
Commissioner Carringer,
Present.
Commissioner Smith,
Here.
Commissioner Nystrom,
Here.
Commissioner Schoonmaker,
Here.
Commissioner Anders,
One last time, I'm here.
Commissioner Bustler,
Here.
Commissioner Beeler is out, Commissioner Daly,
Here.
Commissioner Jay,
Here.
Commissioner Biggs.
Here.
10 members present.
All right, very good. Thank you, Madam Clerk. Madam Clerk, could you, I believe we were on item 67.
That's correct.
So if you could go ahead and begin with that one.
It's ordinance O-20-7-101. It's amending Knox County Code, Chapter 58, Article 3, entitled Hotel Occupancy Tax, to remove exceptions in the definition of hotel for rentals in residential settings. This amends the Private Acts 1982, Chapter 47, Private Acts 1996, Chapter 628, Ordinance Number O-90-9-119, Subsection 1, September 10th, 1990, and Ordinance O-97-7-103, Subsection 1, adopted August 25th, 1997. This is on second reading.
Motion to approve, Mr. Chairman, and I'd like to make an additional comment after the second.
Okay, I'll come back to you after the second. We have a motion for approval. Who's the second?
Second.
All right, seconds, Commissioner Anders. Back to you, Commissioner Schoonmaker.
Thank you, Mr. Chairman. Governor Lee signed this in as a public chapter back in June 22nd of this year. And the intent was to have this in place by September 1st of this year. So my request would be for the Knox County Clerk's Office, as well as the Knox County Law Director's Office and the Knox County Mayor's Office to go ahead and sign this so that it could take effect on September 1st of this year.
Good work. Okay, we can now, and John, I appreciate all of your work in following these bills. You've got quite an eagle eye for you and the legislative committee, so thank you. I'll now move to the clerk's office to do a roll call vote on this item.
Commissioner Smith,
Aye.
Commissioner Smith votes aye. Commissioner Nystrom,
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker,
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders,
Aye.
Commissioner Anders votes aye. Commissioner Bustler,
Aye.
Commissioner Bustler votes aye. Commissioner Beeler is out. Commissioner Daly,
Aye.
Commissioner Daly votes aye. Commissioner Jay, Commissioner
Yep, Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs,
Yes.
Commissioner Biggs votes aye. Commissioner Gill,
Yes.
Commissioner Gill votes aye. Commissioner Carringer,
Aye.
Commissioner Carringer votes aye. All members present voting aye.
All right, thank you, Madam Clerk. I think that gets us through the lion's share of the main agenda. We now need to go back to the consent agenda for the general government calendar. Is that correct?
That's correct.
Okay, if we could have a motion for approval, and motion for approval from Commissioner Daly, and is there a second? And a second from Commissioner Gill. So we have a proper motion and a second. And Madam Clerk, this is for the general government consent calendar. If you could please read that into the record.
Okay.
For Tyler Alexander, Mize out with the Cubs leading 3-1. He gave up.
It starts on page 7. Resolution 110 is appointing Steve Weiner, District 5 seat, to the Knox County Library Advisory Board. 111 is reappointing Gary Fleener, a citizen member with benefits administration experience, and appointing Joel Beavers, a citizen member with financial management experience, to the Knox County Health Insurance Appeal Board. 112 is confirming the Knox County Mayor's reappointment of Rob Quillen as the hearing officer for violations associated with the ordinance regulating sexually oriented businesses within Knox County. 216 is a resolution approving a grant contract in the amount of $51,900 with the Tennessee State Library and Archives for general library services and library materials. No local match required. 301 is approving a memorandum of understanding with the City of Knoxville for the administration of the 2020 Edward Byrne Memorial Justice Assistance Grant, JAG Award and authorizing the acceptance of a grant funding in an amount up to $42,071 as Knox County's portion of the grant award. 401 is approving covenants for permanent maintenance of stormwater facilities and best management practices with the Industrial Development Board of the County of Knox for property located at 5105 South National Drive, CLT parcel ID, parcel number 1110-02625. 402 is approving covenants for permanent maintenance of stormwater facilities and best management practices with Mesa Properties LLC for property located at 720 Simmons Road, CLT parcel number 118-17320. 403 is approving covenants for permanent maintenance of stormwater facilities and best management practices with Brian M. Bowling for property located at 2320 Keller Bend Road, CLT parcel number 155-024. 404, approving a local agency project agreement with the Tennessee Department of Transportation, TDOT, for the Cherahela Extension Project from Cowardville Road to Horseshoe Bend Road with with an estimated project cost of $6,200,000 and Knox County responsible for an estimated $4,200,000 for the project cost. 405, approving a joint funding agreement with the U.S. Geological Survey in the amount of $60,000 with $30,000 provided by Knox County and $30,000 provided by the U.S. Geological Survey for the operation of stream gauging stations in Knox County for the period beginning July 1st, 2020 and ending June 30th, 2021. 406, approving a contract with Whaley Construction LLC for concrete work and repair services as needed. 408, approving covenants for permanent maintenance of stormwater facilities and best management practices with LKM Properties LP for properties at 7420 Tazewell Pike, CLT parcel 0 number 021-06602 and 0 Tazewell Pike, CLT parcel number 021-06601. 501 is number one, authorizing the acceptance of federal funds in an amount up to $710,097 in HUD CARES Act CDBG CV supplemental funding. And number two, approving a substantial amendment to Knox County's previously approved 2020 and annual action plan to include programs such as rent, mortgage and utility assistance for low to moderate income households, and small business relief utilizing the above mentioned funds to assist those directly impacted by the coronavirus pandemic. 601, approving a grant contract in an amount not to exceed $321,200 with the Tennessee Department of Health to provide high impact area substance misuse epidemic response services for the period beginning September 1st, 2020 and ending August 31st, 2021. No local match required. 602 is authorizing the acceptance of a donation in the amount of $2,800 to the Knox County Health Department from WKZX 93.5, the Lighter Radio for public service announcements. 603 is approving a memorandum of agreement with the City of Knoxville regarding the use of the Knoxville Chilhowee Park and Exposition Center, the Jacob Building. 604 is approving a grant contract in an amount not to exceed $156,900 with the Tennessee Department of Health for the provision of grant and aid funds for the period beginning July 1st, 2020 and ending June 30th, 2021. No local match required. 605, approving laboratory services agreement and an amendment thereto with Integrity Laboratories LLC for the provision of reference laboratory services. 606 is authorizing the acceptance of a donation in the amount of $150 to the Knox County Health Department from Zoe Balu for WKZX 93.5, La Lighter Radio public service announcements. 607 is approving a contract with Premier Medical Incorporated for the provision of reference laboratory testing services for the Knox County Health Department. 608 is approving an agreement for laboratory services and an amendment thereto with Associated Pathologists LLC doing business as Path Group for the provision of clinical laboratory services. 701 is authorizing the acceptance of a donation of a memorial bench at the Cove at Concord Park from William T. Willis, valued at $1,600. 702 is authorizing the acceptance of a donation of a memorial bench at IC King Park from Legacy Parks valued at $1,470.50. 703 is approving the following lease agreements in the amount of $5,000 each. American Youth Soccer Organization Region 128 for 1831 Hitching Post Drive, Ball Camp Soccer Complex. American Youth Soccer Organization Region 337 for 2065 Rifle Range Drive, AYSO 337 Soccer Complex at Tommy Shumpert Park. American Youth Soccer Organization Region 1390 for 5428 Strawberry Plains Pike, Forks of the River Park, and Tennessee Valley Football Club doing business as FC Alliance for 2801 Ball Camp Byington Road, Meadow Creek Soccer Complex. 705 is approving a contract in an amount not to exceed $99,433 with the Knoxville Football Officials Association for providing officials to the Knox County Parks and Recreation Department's Youth Football League for the 2020 season. 801 is approving a professional services contract with Ernst & Young LLP for the provision of federal cost recovery services. 802 is approving an amendment to lease agreement, original contract number 0-109 between Knox County and Concord Marina of Knoxville LLC to add 13.82 acres to the leased premises and accept and authorize the improvements to the property on the concept site plan attached to the amendment. 803 is approving a post-mortem agreement with East Tennessee Children's Hospital, ETCH, whereby the Knox County Regional Forensic Center provides a post-mortem professional services for ETCH. 901 is authorizing the acceptance of a grant award in the amount of $4,000 from the Knoxville Bar Foundation to provide stipends and for educational workshops for social work graduate student interns at the Knox County Juvenile Court. 902 is approving a contract with SH Data Technologies for information technology services, including co-location server hosting, network infrastructure services, and cloud service connectivity. 903 is approving a grant contract in the amount not to exceed $427,059 with the State of Tennessee Department of State Division of Elections for the provision of assistance for county election commissions to prevent, prepare for, and respond to the coronavirus. No local match required. And 904 is authorizing the acceptance of a donation of a three-dimensional laser printed model of the Sun Sphere valued at $1,000 from Volunteer Aerospace. That's it.
Okay, thank you, Madam Clerk. That motion is properly before us. All in favor, please say aye via a roll call vote.
Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bustler.
Aye.
Commissioner Bustler votes aye. Commissioner Beeler is out. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner J.
Aye.
Commissioner J votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Aye.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Aye.
Commissioner Smith votes aye. All members present voting aye.
All right, thank you, Madam Clerk. It passes. Okay, we have actually, believe it or not, worked our way through the entire agenda except for other business and public forum. I know we have some residents who'd like to speak to us at public forum, and I'd like to get them on as soon as possible. As I mentioned, the other business will really just be, I've got one point to make about to tee up our reorganization for all of you. Obviously, I won't be there, but we'll get to that as soon as we go through public forum. So, and then I'm sure there'll be some announcements as we wrap up the meeting. So I'll go ahead and Mr. Link, we've got, I believe, as I look through the next leg of folks who would like to speak to us at public forum, want to remind everyone that it's 5 minutes, and after you've said your piece during public forum, you'll be out of the meeting and you can watch the rest of it via the link or through CTV, not in the Zoom. So, but the next name I have on my list is Miss Debbie Stafford.
Chairman,
Yeah,
I have a quick question for the law director.
sure. Yeah, David.
Director Book, can you just refresh my memory real quick on a board that we appoint, do we still have, do we still have the opportunity to just kind of refresh everything that we stated before? I mean, it's been 2.5 hours almost. Can you just refresh everything for our public forum speakers, please?
Mr. Biggs, this is David Sanders. I'm not sure Mr. Book is still with us. Are you referring specifically to the Board of Health or to a different entity?
Yes, sir. I would imagine that some of these people at public forum are going to be talking about the Board of Health, and it's been some time, so maybe refreshing what we stated earlier could help.
Okay, I'll go through it briefly. The Board of Health is not mandated. The Board of Health is comprised by members whose membership is determined by statute. That is, the statute states that if you have a Board of Health, and that's optional, but if you do, it must be comprised of certain members. And those members are the mayor, the superintendent of schools or his designee, 2 doctors, a dentist, a pharmacist, and the board, actually 2 separate health officers in the county, although Dr. Buchanan holds both titles, that is the county health officer and the county health director. And optionally, the Board of Health can also include a veterinarian, and you all chose to do that by resolution a few years ago. The Board of Health can also have a citizen member. You all have not chosen to do that, but you could do it by resolution. What I spoke of earlier as far as removal of members of the Board of Health is that this entity does have the power under statute to remove a member for cause, but that for cause does not mean that you all are disagree with their policies or disagree with the science that they form their regulations on. It has to be something along the lines of fraud, malfeasance, or moral turpitude, more or less the malfeasance being more or less committing a crime in office. This is not removing the officers for cause is not simply we don't like what they're doing. Is that sufficient?
Yes, sir. Thank you, sir. I appreciate that.
Okay, thank you, Commissioner Biggs. Back on the list, I believe our first person is Miss Debbie Stafford. Miss Stafford, if you're here. Okay, we will, I'm not sure if she's here, but we can certainly move on and come back to her. The next citizen is Miss, ma'am, I hope I pronounced it correctly, Liga, L-I-G-I-A, Liga Siusa, if I'm pronouncing that right. And ma'am,
That would be me. It's Ligia Siasu.
okay, I'm so sorry. I did a horrible job on that.
Absolutely no worries. I'm used to it.
Okay, if you could just state your name and address for the record, and then
Sure.
you've got 5 minutes, please.
Thank you. My name is Ligia Siasu, and I live at 11604 Gates Mill Drive, Knoxville, Tennessee, 37934. And just to start off, I'm not here to complain about what the board has done. I believe that they truly have done a lot of good things for this beautiful city that we live in. But my concern is what has not been addressed. So if I could just quickly read what I wrote, it's a little recap or maybe a repetition, but that's kind of what I'm gonna talk about. Okay, let me go. And the emotions are high, so bear with me. Knoxville has been our home for the past 16 years. I can't imagine a better place to live and raise our kids. My husband and I are very grateful for the city leaders that work tirelessly to uphold the US and Tennessee laws that have been put into place to protect the citizens of this amazing city. As city leaders, you have been given the difficult task of figuring out what is the best way to protect the citizens of our city during these unprecedented times. using information that is constantly changing, not always clear, and sometimes faulty. We understand that this is not an easy task to bear. The complexities that are involved in such a difficult task must be unimaginable. We appreciate the efforts that have been put forth thus far by the Knox County Board of Health. I have no doubt in my mind that all the decisions that were made with the intentions of protecting the citizens of the city. Unfortunately, even our best intentions can produce unexpected and unintended harm. Since the beginning of this year, my heart has been heavy with despair for our city and our country. I was born in communist Romania. For the first 9 years of my life, I experienced things that no human being should ever have to experience. I believed, after many years of living in the US, that I healed emotionally from my experiences as a young child under communism. But in the past 5 months, I have realized that such experiences do not ever go away, and scars are permanent. During the forced mandates that the city has undergone, vivid memories of government overreach in communist Romania have negatively affected me daily, and worries and anxieties of how these past 5 months have affected my children brings even more fear. Never in my wildest dreams did I think that in the year 2020, with all the knowledge that is at our fingertips and the experience the world history affords us, we would ever face communist-like mandates under any circumstances. When a board is elected to help protect the public from the dangers such as COVID-19, it cannot and should not be allowed to use communist-like overreach measures to try to solve the issue at hand. As history has proven, such measures do more damage than good in the long run. Because of the overreaching measures that have been allowed to be used in our city, we have seen mental health cases double in our city. Suicide rates have skyrocketed. Businesses have permanently shut down. Citizens have lost their livelihoods, and division and fear can be felt in our city. As an example, we have friends that are still self-quarantining themselves due to the fear of the constant use of the COVID fatality rate, which in Knoxville is very low. They are afraid of being infected, and they are being afraid of infecting elderly people. My daughter spends much of her allotted phone time encouraging other teens and helping them overcome the paralyzing fear they are experiencing. Once again, I understand that the intentions of the Board of the Health were meant to protect our city, but due to the negative unintended effects of their mandates, I asked the appointed members of the board be removed. Now that has been discussed and said that because they have not committed a crime, that cannot happen. I'm
Okay.
not sure
Ma'am,
that
ma'am,
causing, yes.
ma'am, I'll give you about 30 seconds, then you've hit your 5 minutes. So
All
thank
right,
you.
thank you. So we ask that the board members that are remaining that have been added to the board be removed. But if that is not possible, at the very least, since we are dealing with a pandemic, we need a virologist, an economist, and a mental health expert to be on this board. And I am very saddened to see that a citizen has not been involved. So you may hear the stories that we are experiencing
Okay,
in
thank
our
you.
community. Thank
Thank you.
you.
Thank you for joining us. We appreciate that. Thank you.
Thank you so much. We appreciate your time.
Okay, next is Miss Molly Clark.
Hello. I hope you guys can see me okay. Thank you, Commission, for giving me a voice tonight. I appreciate that. I'll start by telling you that I love Knoxville. I've lived at 2805 Buffett Mill Road for the past 10 years and have grown into a volunteer. I was a realtor for 4 years in this town and have proudly helped many people move into Knox County. I've always thought the people here are very measured and overall look out for each other. I appreciate how Mayor Jacobs has been handling the COVID-19 issues. My husband and I own an engineering firm in Knox County, and these decisions have affected our business, both our business effectiveness and operations. I'm the operating CEO of my company, and also I homeschool my children as well. So I have both a business understanding and a mom teacher understanding of how this is affecting my community. Now, if you would have asked me last year that in 2020, the Board of Health would be mandating Knox County to wear a mask in public buildings during a pandemic without solid evidence to support the need, I would have said, no way, not in my town. Homemade mask, paper mask, N95 mask, any mask will do, just wear the mask, they say. We were all on board at first. Let's do our part. Let's keep the hospitals tolerable. Then my sister got furloughed from Children's due to the lack of business. So all of this leaves me scratching my head when other countries like Sweden are now coming out ahead with their masses having developed herd immunity to COVID-19 while we run around town with a piece of paper over our mouths thinking that this virus is just going to go away. On this matter, the Knoxville Board of Health has been designated to represent my best interest in my health. I'm sure that they have a role to play in recommendations to our elected officials, but they should not have the authority to tell me how or how not to breathe. If you, my elected official, as a commissioner, do not agree with the steps taken by Knox County Board of Health, are you able to say no if they have not done anything malfeasant? Remember, taxation without representation? This feels like healthcare without representation. Every person on this call has been affected by COVID-19 and mask wearing. We are made to be relational people. We now, with mask wearing, have been degraded from pleasant relational people to germ potential interactions. When people are scared, they look to their leadership to direct them, and that's you guys. If you take a stance of fear, they too will be fearful of COVID. If you make measured decisions based on solid science, then they too will follow. Can we be free to decide if a mask makes sense for us as individuals? We all agree some people would be better served by staying home or by wearing an N95 mask, the elderly, the immune compromised, or those who have comfort in wearing it. But one size does not fit all, and it is generating unnecessary fear. The healthy are not able to function. One of my daughter's friends, who is 9 years old, has not seen any other children since March and has no plans to return to school this fall or see any other children. Some of our work clients have been afraid to come into the office. Many of my friends are looking to move out of Knox County. They get the sense that Knox County is unrealistically waiting to become germ-free. Respectfully, I ask you to dig deeper into the science and consider that your constituents' mental health has been exchanged for the overarching mandates of the Knoxville Board of Health. Will you say when the board requires that all people get COVID-19 vaccination regardless of their situation? You are the authority as elected by the people, and as your constituent, I ask you to exercise your right to either remove the board or at least add a private citizen to the health board. Thank you for your time. I can't hear.
I'm sorry. Yeah, thank you, Ms. Clark. Next, Ms. Elizabeth Murphy. And Ms. Clark, if you could close out of this meeting, and then you can watch the rest of the meeting via the CTV.
Yes, thank you.
Thank you. Is Ms. Murphy here? Not seeing her. Okay, Ms. Sherry Garrett. Sherry here?
I'm here.
All right, Ms. Garrett, you've got 5 minutes.
Okay. Tennessee Code 68-2-601, Section F2. Through the county health director or the county health officer or both, enforce such rules and regulations as may be prescribed by the commissioner essential to the control of preventable diseases and the promotion and maintenance of the general health of the county. This is what the Board of Health is required to do for the statute. but this falls short of what is actually going on. As of today, COVID-19 has had 5,979 positive cases in Knox County out of 470,313 residents as of 2019. 1.27% of Knox County residents have tested positive for COVID-19. We currently have 2,225 active cases out of 470,313 residents. That is 0.47% of Knox County residents who are currently actively infected with this virus. I call to attention the testimony of Dr. Martha Buchanan, Knox County Health Director, last Monday. She testified that the Knox County Health Department has reduced services until the end of the calendar year and possibly beyond to focus on COVID-19. Let me bring to the Commission's attention the services that have been reduced. Women, infants, and children, otherwise known as WIC. All WIC services will be done by phone, per the Knox County Health Department's website. WIC evaluation visits evaluate the height, weight, or length of the child who assessed for nutritional deficiencies, especially in at-risk children and also pregnant and nursing women. They screen also at times for anemia in infants. How can this be done via telephone? Other services such as women's health and communicable disease are done by appointment only. Dental services are emergencies only, which means that routine evaluations and cleanings are not being done. Not getting routine dental care can lead to more problems later on, cavities, root canals, which are more expensive to treat. There's also medical risk. In some cases, untreated cavities can lead to abscesses, a mouth infection that can result in other more serious systemic infections in the body. Community health services are suspended at this time. I repeat that, services are suspended at this time. What is listed under the community health section of Knox County Health Department? East Tennessee Two-Step, a healthy weight initiative. We know that the overweight and obese population are at higher risk for complications from COVID-19. Yet the health department has chosen to suspend a program that may reduce that risk for that population. Worksite Wellness, a program that encourages wellness in places of business. Senior exercise classes. We know that seniors are at risk for complications, yet a program that could help them reduce their risk has been suspended. Add to that the isolation of seniors who have had the opportunity to gather with their friends and socialize. The health promotion, which included the stairwell campaign to encourage employees to become more physical at work by taking the stairs instead of elevators. This also includes the adolescent pregnancy prevention, smoking cessation, unintentional injuries, which address issues of seniors falling and prevention, and the diabetes prevention. We know that diabetics are at much higher risk of complications from COVID-19. Violence prevention. The Rape and Violence Prevention Program provided development and support for primary prevention of rape, sexual assault, and interpersonal violence in Knox County. By reducing and suspending necessary services such as WIC, healthy weight, diabetes prevention, and violence prevention, it negatively impacts those who are specifically at high risk of developing complications. The Board of Health seems to be more focused on COVID-19 to the exclusion of all other health issues that the other 99.53% of Knox County residents have, which is failure to perform their official duty. It may not be malfeasance, but it is failure to perform the duty that they are called to do per the statute. And as I have about a minute left, I wanted to bring up something that was said earlier, that we are doing this because we disagree with personalities. We may disagree with personalities on the board. We don't know the board. We don't know their personalities. That has nothing to do with how we feel about what we're doing. We're providing you statistics and facts and data that we have researched. And it's even been said, there are many, many people out there who have stories of actual things that they have experienced, negative things they've experienced because they cannot wear a mask. Businesses are refusing services to anybody who cannot wear a mask. They are not allowing for medical exemptions. And there are many people who are medically exempt due to COPD, emphysema, asthma, and other conditions. Thank you.
All right, thank you, Ms. Garrett. Next is Ms. Cindy Miller. Is Ms. Miller present? Okay, not seeing Ms. Miller here. Ms. Mila Glushvenka, I'm having a hard time with that name. So ma'am, if you're here, Mila, Glushchch, ENKO.
Mr. Chairman, Elizabeth is connecting now.
Okay, all right. All right, Ms. Murphy, you were asked earlier to come on. So if you're here, you've got 5 minutes. If you could please state your name and address for the record.
Sure. If you want to go to someone else before me, I was just getting back home, so I need 10 seconds to pull up my materials. I just logged back on. But if there's no one else, then I can do it quickly.
Just go right ahead while we have you. Go ahead.
Sure. 1 second. My name is Elizabeth Murphy. I live at 400 Taliwa Drive, 37920. This is a statement written by author Furstenberg detailing
Ms. Murphy, if you could turn on your camera, that'd be great. Thank you.
Sure. Sorry about that. This is a statement written by Arthur Furstenberg detailing the scientific evidence that masks do not prevent the spread of disease. As a person who went to medical school, I was shocked when I read Neil Orr's study published in the 1981 Annals of the Royal College of the Surgeons of England. Dr. Orr was a surgeon in the Several Surgical Unit in Colchester, and for 6 months from March through August of 1980, the surgeons and staff in that unit decided to see what would happen if they did not wear masks during surgeries. They wore no mask for 6 months and compared the rate of surgical wound infections from March of 1980, from March through August of 1980, with the rate of wound infections from March through August of the previous 4 years. They discovered to their amazement that when nobody wore masks during surgeries, the rate of wound infections was less than half what it was when everyone did wear masks. Their conclusion was, it would appear that minimum contamination can best be achieved by not wearing a mask at all, and that wearing a mask during surgery is a standard procedure that could be abandoned. He was so amazed that he scoured the medical literature, sure that this was a fluke and that newer studies would show the utility of masks in preventing the spread of disease. But to the surprise, the medical literature for the past 45 years has been consistent. Masks are useless in preventing the spread of disease, and if anything, are unsanitary objects that themselves spread bacteria and viruses. Ritter in 1975 found that wearing a surgical face mask had no effect upon the overall operating room environmental contamination. Lassless and Sabin in 1989 found that caps and masks were not necessary during surgery. No infections were found in any patient regardless of whether a cap or mask was used. The same conclusion was found by Solt and Skabeck in Sweden in 2002. In the Thunvalls 1991 study, a general surgical team wore no mask in half of their surgeries for 2 years. After over 1,500 operations performed with masks, the wound infection rate was 5%, while after 1,500 operations performed without masks, the wound infection rate was only 3.5%, a full 1.5 points lower. A review by Skinner and Sutton in 2001 concluded the evidence for discontinuing the use of surgical face masks would appear to be stronger than the evidence available to support their continued use. Lamy in 2001 wrote that surgical face masks worn by patients during regional anesthesia did not reduce the concentration of airborne bacteria over the operation field in her study. Thus, they are dispensable. Figueroa in 2001 reported that in 5 years of doing periodontal dialysis without masks, rates of periodontitis in their unit were no different than rates in hospital where masks were worn. I could keep going. There's at least 10 more studies that show that in OR situations, masks do not change the outcome of infection. Yet we have communities, our whole Knox County, who are being forced to wear masks by a board that was not elected but appointed. I hope the preparation I presented that masks do not prevent the spread of disease will show you that the Knox County Board of Health needs to have members removed due to malfeasance. I know that y'all aren't going to do that, and so I ask that you at least consider having a citizen representative added to the board. Right now, we are operating off of faulty materials. There is massive amounts of scientific literature out there. I will email you these 15 studies that prove masks do not stop the spread of disease, period. Thank you for your time.
Thank you. All right, next is Mila, come back on. All right, Glenn Stafford. Is Glenn here? All right, Angela Holste, Holste. Is Angela here? All right, I think the last few folks did not stick around. So yeah, Commissioner Biggs.
Chairman Nostrom, through a lot of public forum, I've noticed tonight specifically that there's a lot of call for a lot of people that are wanting representation from a citizen side. And Law Director Sanders stated earlier that we do have the opportunity to do so. I think he said it's TCA code 68-2-601, where we can, by resolution, put somebody on there. So coming from that tonight, I think we need to start looking as a body, maybe headed in that direction. I don't care to prepare a resolution to put on the agenda and maybe take in some nominations or whatever, but just from hearing, I'd like to know what my fellow commissioners think, or if you, because that's the direction that I'm leaning after tonight.
Okay, thanks, Commissioner Biggs. Commissioner Daly?
Thank you. I agree with Commissioner Biggs. We need to look at not only the citizen, but maybe some other specialists that were mentioned tonight, epidemiologists and other ones. So we increased this board. I guess this is for the law department, Mr. Sanders, that how many can we add to this board? And we probably need an odd number for voting, but not only do I support the citizen, but I would support other specialists on there that were mentioned tonight. So thank you, Justin, for bringing that up.
Shall I respond, Mr. Nystrom?
Yes. Yeah.
Commissioner Daly, as well-intentioned as those ideas are, the statute only grants authority to add a citizen representative. There is no authority to grant a psychologist or someone in a different field. The statute's very clear about what is allowed, and it's the mayor, the director of schools, 2 medical doctors, 1 dentist, 1 pharmacist, the health officer, a veterinarian if you wish, and a nurse. It doesn't have there's no slot for a psychologist or some of the other specialists that the various speakers have spoken to. But you can add a citizen by resolution if you would like.
Chairman?
Yes.
If I were, I could put it on the form tomorrow, but the body of commission, if just by tonight, could we put forth something for next month then? Maybe I can go work with the law director's office to make sure that it's specifically stated the right way.
Well, I mean, as a commissioner, you've definitely got that right. I mean, to meet with the law director on that. So, and then bring forth a resolution.
I'd like to hold the full support of the body though, if that's okay.
I mean, yeah, I mean, go for it. Do whatever you want to do, Mr. Biggs or Commissioner Biggs, knowing that you'll have a different body of commissioners in just about a week or so that will be working on this too. So that would be kind of a different group that would be voting on it. So it's you may, my personal opinion is you may want to start doing the homework on what can and can't be done, and then make sure that you try to work on that with the new commission. But go ahead, Commissioner Jay.
I'll just add that if you head down that path, thank you, Mr. Chairman, that you might also just think through how that might happen, how might nominations come in, how might that person be selected, under what circumstances, and when, I think sitting down with both the health department, maybe the board of the health board and the law department, all to sort of understand the mechanics of it would be helpful before just,
And what I would say is, and I'll get Commissioner Bustler just a second, and Schoon, is that, we do have set commission rules when we appoint people to boards. So I think once you verify that there are rules, we've appointed a lot of different people to a lot of different committees, but I would guess that this type of appointment would be, if the next commission so chooses to do that, would be done in a similar way. And I'm sorry, I think I'm going back to Commissioner Bustler, then Schoonmaker.
Thank you, Mr. Chair. One thing I would like to mention, Justin, you've got Commissioner Biggs, rather, you've got a good idea there, but we also have, we used to have what we call committee on committees, that we looked at different things and make sure that we didn't get into the spots we're in tonight. So I wish we would look at that too when we get our next commission together and organized and really get the committee on committees working again. Thank you.
Yep. Thanks, Commissioner Bustler. Commissioner Schoonmaker.
Thank you, Mr. Chairman. One of the speakers this evening mentioned the suspension of services from the Knox County Health Department. And if we still have Director Buchanan here, maybe she could address when those services would be reinstated.
Yeah, or how much have actually been canceled or changed. Martha, I see you still down there. So if you want to weigh in on this. I'm not sure if she's still here. Dr. Buchanan, are you still on the, there you go.
Sorry. Yes, I'm still here. So, Commissioner Schoonmaker, our services are limited. We're still doing services. Our WIC participation is higher than it's ever been, to be honest with you, because it's convenient, easy, and moms like it. So babies are still getting the nutrition they need. Moms are still getting the education they need, and participation is higher than it's ever been, honestly, which has surprised us. And we're still seeing folks for STDs, and we're doing our back to school vaccinations. We've increased vaccinations for that. So we're slowly increasing services as we can. We are also, as you've seen, we had several contracts to bring on temp staff to help backfill so that staff can return to their regular duties in all of those different areas. We just hired, just agreed to take some grant money to hire a position to focus on overdose deaths and start that work up again. So we are slowly but surely starting that work up again as staffing allows. And women are still getting birth control. We restarted IUDs, but then had to stop them again because of needs related to the response. So again, we're slowly bringing staff on and training them so that our other staff can go back to their regular work. I don't have a definite deadline of when we'll be able to do that, because a lot of that depends on the COVID-19 response. A lot of that depends on how quickly we can bring folks on to fill those positions and start doing the COVID work that then allows my staff to return to the regular duties. I can certainly keep you guys posted on that. But we're, providing limited services, including vaccinations. We're not doing travel vaccines. That's something that we did suspend with not a lot of traveling going on right now. People can still get birth and death certificates. We're still doing restaurant inspections. So we are still doing several things in a limited capacity so that we can focus on the response. Does that answer your question?
Okay, thank you. Yes.
Sure.
Yeah. Thank you, Commissioner Schoonmaker. Any other questions for Dr. Buchanan while we've got her? Okay. It's hard to believe that brings us to the last item on our agenda, which is the other business. And I thought it would be prudent just to bring up the subject of reorganization. Clearly, several of us will not be here for that, but operationally, two things to consider. All right, it's my assumption that everybody who's going to be still on county commission would like Commissioner Beeler to still be part of that. I think that goes without saying. We also have our two commissioners that have been asked to stay at home. I think that ends to confirm, I think it was the end of this month to confirm that. So if the governor doesn't extend his executive order, then the meeting will have to be in person in September. If the governor does extend his executive order, y'all may want to meet via Zoom to make sure that Commissioner Beeler's vote counts. Based on our rules, and I believe in the charter, the county clerk would actually convene the meeting and serve as chair until a new chair is appointed. So that Sherry would have to lead a meeting via Zoom because Commissioner Beeler's not out, he has not, I don't know the details, but he hasn't tested negative yet and hasn't gotten that timeline of 2 weeks away where he could come to an in-person meeting. But I'm speaking for y'all, knowing that y'all are probably going to want to make sure that Commissioner Beeler's voice is heard at that meeting. So you may find even, that it might behoove you to consider doing it via Zoom if the governor makes that available so that you can include Commissioner Beeler's voice. Yes, Commissioner Jay.
Thank you, Mr. Chairman. I think the law department in earlier communications that they anticipate that extension would be forthcoming. Is that correct?
That is correct. Well, I'll let the law director, but he said forthcoming, but we still haven't seen it yet. So I think it's fair to sort of throw it out there just to know that's something y'all will have to consider. Yes, Commissioner Smith.
I just think real quick, given that if that is extended, that we should go ahead and plan on just keeping the date and the time and planning on a Zoom meeting to do it to keep our order. If we push it back several weeks, that gets close to the September work session and commission meeting.
Chairman, this
Yes,
is
sir.
David Boog. You're right. What the governor has done 4 times now, the day before the expiration of an order, he puts down a new executive order extending it for another time certain. And so I anticipate that that's what will come forth. This one wears out on the 29th, I believe. So I believe that you might look for something on the 28th, sometime this week. You'll come down with a new executive order. That's my anticipation.
Well, we'll plan for either scenario. Go ahead, Commissioner Smith.
I believe Dr. Buchanan has left the building. Dr. Buchanan, are you still here? I was going to ask her what the CDC protocol is for someone that's tested positive, what the quarantine is after a negative, or if it is just a straight 14 days.
Commissioner Bussler? Yep.
Thank you, Mr. Chair. I got off the phone this morning with the State Department, the Health Department at the state level, and I asked that, what do you do with quarantine? And she told me, and I've got her name, and she told me that you really had, instead of 14 days, you had 10 days. If you weren't showing any symptoms, you could pretty much go back to your regular activity because you're not showing any disease in you. So it really is basically 10 days from the state level is what the state health department told us instead of the 14 days.
I was trying to figure out if the governor doesn't extend the executive order and Commissioner Beeler will not be available on the 1st for an in-person meeting. I was thinking of that scenario also.
Well, I would, my take is we'll plan for any scenario. We've got to assume the worst, that, we want to be ready to make sure Commissioner Beeler is part of this, and he may not be able to join us either way. In a week or two. I mean, I just don't. That's my advice on that. Hopefully, you'll be able to meet via Zoom. Go ahead, Commissioner Smith.
I think the problem is, depending on when he extends the order, if we have time to give notice of which way we're going to go.
Yep. What do you think, Mr. Law Director?
I think Commissioner Smith is right. You need to, with this meeting here, because it was an emergency under your rules, if the chairman and the mayor agreed and there's a state of emergency, which there has already been declared, then you could waive the 48-hour rule for public notice. And that's what happened, why this meeting went ahead, because it came at the last minute. We talked about that, I think,
Friday. Yeah.
Mr. Chairman, late in the afternoon on Friday, you and the mayor and I were all together, and you knew about that rule, and I informed the mayor of that rule, and we all agreed that it was one of those situations. But to get back to the question that Commissioner Smith had, yes, you need to make up your mind with plenty of time to give the normal notice, because this is a planned meeting. It's not an emergency situation at this point. You've got the time, so do it in plenty of time to get the notice.
Mr. Smith, you've got a question? Go ahead.
Mr. Law Director?
Yes.
Could our notice include a either or option?
That's a good question. We have done that with the zoning, either or, and due to the circumstances, I think that's okay. But the sooner you make it available to the public, so that mostly for the like you did on this one, somehow we got all the information out to all these people that wanted to come in for public forum. As long as you do that, I think you're in good shape. But the sooner you make the decision, the better.
All right. Thank you, Law Director. And Commissioner Jay?
In following up on that, are you saying that you could essentially go ahead and schedule a meeting for the 1st, assuming, with the caveat of if the extension is ordered to meet electronically? If not, then the meeting would be postponed until a future date, or pick that date.
Or we could notify that the meeting will take place. It will take place this date. It will take place either electronically or in person.
Okay.
That way you get your new chair and the new leadership team in place as soon as possible to begin planning and moving forward towards the next cycle. Yeah, that strikes me, in my personal opinion, as the best way to do it. Go ahead, Commissioner Smith.
Yeah, Mr. Law Director, I don't know if we could postpone it because that would require suspending our rules. And I guess we might be able to do that through the forum.
I hadn't thought of that, but you're right. Your rule says on September 1 or the next day. That's what your rule says. So you'd have to suspend that rule, which you can because it's a rule. But you'd have to have a meeting to do that. You could have a special call meeting to do that. But that's up to you. But that's what the rule says. It's September 1 or the day after, unless the rules changed.
All right, point of clarification, and I'll get to Mr. Anders. You could have notification, and you could have, since we're still operating under electronic medium, I would think that the commissioners forum would be sufficient if you needed to do something like a vote to suspend a rule. I think that would be in the public, but
well, no, you can talk about it on the forum, but you can't take that formal action.
Okay.
Hey,
all right. Well, Commissioner Anders.
Yeah, Drew, in her notice, Drew has said it is possible that the special session will be moved to an electronic meeting via Zoom contingent upon extension of the governor's executive orders. If the meeting is moved to Zoom, the meeting will be available to the public. So she has put the either or in the notice.
Yeah.
But that sounds good to me. Drew's done the right thing there. And I think if you do it that way.
Yep.
Drew's always ahead of everybody.
Hey, we talked about it a while back, so I think we're good to go. Raise your hand. Anybody else want to comment on this matter? Commissioner Smith?
Go ahead, Mr. Anders.
No, I have a closing statement. I don't have a comment on this.
I was wondering if if the governor doesn't extend the order, we get to September 1st and Mr. Beeler is still not able to join us. Do we just go ahead with the meeting without him, or what can we do at that point to suspend our rules? Because I don't think we could do that at that meeting unless it is an item that's on the agenda. And I don't know if our organization and meeting can have anything like that on the agenda.
Probably not. You just have to go without Commissioner Beeler. Unlike the school board, which statute says that if you got a sick member, he can appear by it, but you could only have one member do that. But with regard to county commission, that school board rule does not apply. So you'd have just to be there without Commissioner Beeler.
I think it would also be fair if Commissioner Beeler does not know he's there. Him emailing or sending a notice out of committees he would want to serve on would not count as deliberation. So that is one way that you could do that if he had committees that he had a particular passion of wanting to serve on.
Sure, he could put that on the forum that he'd like to be on such and so committee. No problem with that.
Yeah. Yeah.
Now I want to remind everybody that if we wind up doing a reorganization meeting by Zoom, that is normally a very convoluted and trying meeting because it's something that only happens once a year and has an influx of different people. Boy, you talk about a Zoom meeting.
But we wouldn't have to do a roll call vote.
Yep. Yep. Commissioner Bustler.
Thank you, Mr. Chair. This is very important here too. We're saying, Mr. Beeler has the COVID virus and we've got things that are coming up. So some things we might go to, but if you're at one of these meetings while you're out and someone says they have the virus and you were close to them, then you have to quarantine when you're called that day. So from now on out, we've got to be very careful where we go and what we do, because all they has to say is, well, Mr. Smith, you were at this meeting and there was somebody there and you were close within that 7 minutes, and they will call you and let you know that you can't be there on September the 1st. You have to quarantine. So whatever we're doing, if you got meetings and things that are coming up that you were going to go to, you better watch.
Okay, thank you. Commissioner Carringer.
I just want to add, just because you're somewhere and someone may have it, they have to put you on the contact list. And it's still kind of unclear since everybody was wearing masks last week, in terms of being contact and being quarantined. So that person has to identify you as a contact person.
Sure do.
And preferably that would be when no one's wearing masks and around. So
Okay, I'll be clear. I think we've got some direction to move on this. And Commissioner Dale, I'll let you make one closing comment, and then we can wrap this whole 4 years up.
I want to change the subject if I may.
What was that?
I want to change the subject to, we need to start looking back at our growth plan. During the commissioner's orientation, it was brought up that our growth plan needs to get back on track because our sector plans are so far out of date. Well, mine is anyway, but this new commission coming up, we need to start back on the growth plan.
Yep, I agree. I agree. I think that's about it, folks. I got to tell you, some closing comments, Commissioner Anders, and then we can go around it.
Yeah, I just wanted to, it's been a long time. 12 years is a long time and a lot's going on. But I think there's a lot of people in the room that seldom get recognized or don't get recognized enough. And, Drew and of course, Jolie before her, and then Sharon that's come into the office. A tremendous amount of work. I mean, the chaos that you see on TV is one thing, but with the chaos they deal with us, 11 people getting us together and getting us everything we need. And they've done a great job. And Angie and Kim in the clerk's office, you can't say enough about the work they do. And, going back and doing the minutes is very meticulous, and what they do is great. And I don't think we recognize them enough. And I just wanted to say what big of an honor it is. And if we get to come back, I want to talk about all the department heads that have been right beside us and done everything well. But, Drew and Sharon and then Kim and Angie and their team have done a great job. And I don't think we recognize them enough. And I want to tell them I appreciate all the work they do.
Yeah, absolutely, Brad. It's been a pleasure to have worked with them and all of my friends here. I think, as I mentioned, we're going to walk out of here. Some of us will still be commissioners otherwise, but I'm looking forward to having all these friends in here. So, and look, I see Commissioner Biggs has got somebody little, and I've got somebody right here. He's kind of popping in just to say hi. Some of y'all may remember when I ran for office, he was like 8 or 9 years old, and he's the one who announced it. So it was kind of funny. So, a couple of final words that are meaningful. I do want to say, as you, Rick Ansley, the guy who's the singer, he used to, I was running out of those Pixar movies, and I love Pixar. I used to work for Disney, and I heard that Rick Astley had a collection of Pixar movies that I could borrow from him and maybe even buy. So he agreed, and I went over to finally get all my Pixar movies from him. He gave them all to me, except for one, because he said that he was never going to give me up.
this would be the time that Trey would, really want to walk
He could
out.
roll his eyes. Yeah, that was
I don't get it.
It's a bad joke. So anyhow.
I feel like I should, but I don't.
Yeah, that's all right. But anyhow, thank you, everybody. It's been
I got you. That was a bad joke.
It was. I had to think of it was my last meeting, so I really had to think of a really bad joke to go out on, and that was it. So
That was it.
Success.
Yeah. So thank you, everybody. I look forward to being friends with y'all for years, and good luck to everybody. It's been a pleasure. The mayor's office, for so many of us, we were able to work with 2 different mayors, and he won't be here all night. So it's been a humble privilege to work with so many of you and so many team members that we've all overlapped with. So too many names to say. So I'll be quiet, and we can go around the room if you want. So Smith. Commissioner Smith. Not that I'm putting people on the spot, but I don't want to. All right, go ahead, Randy.
It's very typical of Brad to point out other people on his way out. He has done a great job of service. What I'd really like to hear Brad do is list every commissioner he's ever served with.
Chick-fil-A will be closed before we get done.
Yeah, it's been long. All right, and sort of going in by the window, go ahead, Commissioner Busler.
Thank you. I've got to take a shot at somebody anyway. If you notice Carson, when you're looking on the film here, he's got a halo around his head. But when you look at Brad, he's in the dark. He's gone to the dark side by leaving us. And so I had to take that shot at you. And I want to say it was good to sit beside you. Well, you were commissioner, you were the chairman sometimes, so I didn't get to sit beside of you, which was the best days. But anyway, and also the age thing the other day, I noticed that you were getting on this, what we're doing today, a little bit slower. So the age must be catching up with you. And I hope your next thing that they have access for handicaps for you so you can get in and out your offices. So it was good seeing you there. I had to take a shot at the chairman because he let me go by without getting voted on. So I had to take a shot at him. And Evelyn, what can I say? They say if you can't say anything good to anybody, don't say anything at all. Okay. But anyway, let's go. Who else is leaving? Oh, Evelyn, it was fun being with you on commission. It was fun gigging you every now and then. So anyway, I appreciate all the people I got to serve with. And Michelle, what can I say? If I do say it, I'm in trouble because it's on live news. So anyway, you all have a great day and a great future. Thank you all.
Thanks, Commissioner. And I think Commissioner Gill, you want to take a gig back at him?
No, he's getting old.
Gone.
Oh, she may have stepped out. So, all right. Go ahead, Commissioner Daly.
Yeah, Charlie's getting old, so you got to watch him. Every once in a while, you got to make sure you stay awake. You got to elbow him over there. So thank you guys, Evelyn, Brad, who am I miss? Chairman, and Michelle. Thank you very much, and you will be missed.
All right, thank you, brother. Commissioner Jay.
I just wanted to say thank you all for your service to Knox County. I think last week when we were in orientation for the new commissioners, their eyes were about as big as silver dollars when they, finally come to terms with all that they have to know and all they have to learn and all they have to do to prepare to be a commissioner. And you all four of you all diligently work on behalf of the citizens. And we have a lot of long nights and a lot of extra meetings, a lot of time where you're away from your family. And it's been a lot to the constituents, how well you've served. And I appreciate all of you that have helped me learn a little bit on my way through this process as well. So well done and well served.
All right. Thank you. All right, Commissioner Biggs.
I just want to say I appreciate you guys more than you know. You took, I was, I was 35 coming into this. I'm young, didn't really know a ton about commission, and sitting next to Larson, I remember my first month in, I was so pumped up to get up and do a resolution at the stand. And I know he remembers it too, because I would stand up and then sit down and stand up and sit down. And you guys have made memories with me that I'll remember for the rest of my life. Just watching you guys work and learning from you guys. I've learned something from each of you. I really have. And I can't wait to see what you guys are going to do. Brad, you're an amazing 911 director. I can't see anybody else that would have fit in that role better than you. Michelle, you're going to make an amazing state rep. I love you guys. You're going to do great. Hugh, man, I'm so proud of everything you've done. You've been my chairman for the past 2 years, and it's going to be big shoes to fill, in my opinion, for our next chair. Evelyn's already gone, but I've learned a lot about Evelyn. One of the things that I've learned about her, she's never afraid to voice her opinion, no matter if she knows she's that one vote against 10, and she doesn't understand how much I respect that. She loves her district, she loves her community, and I've seen some great things come out of her. But I love each and every one of you guys. If I can do anything for you at all, don't be afraid to reach out, because now we're not going to be violating the Sunshine Law if you do. And I hope to thank you all so much.
Okay, Ms. Carringer.
Well, I sit here and try to decide what to say. There's so many great things to say. What an honor, privilege, and a joy it's been to serve on Knox County for the past 4 years with all of you all. And I'll just have to say, I hope I'm not going away, and I'm going to get the last laugh on Charles Bessler, because I'm going strong for this November election, and I hope I get to be his next state representative to aggravate him for 2 more years at least.
Awesome. Well, good luck. I think, hey, Brad, you were the opener of the closing statements. Do you want to make a final closing statement?
I don't think John
Okay,
said
no, that's
anything. I don't
Carson.
want to
Sorry, I
take
got
away
to
from
Carson.
him.
Yeah. Go ahead, Carson. Mute. I got a card. I'm trying to go in order on my screen here, but yeah, Carson, you're still muted, and then we'll go up to John. There you go. Oh, you turned it off. Now it's back on. There you go. Whatever you did.
How's that?
Now we can hear you. Yeah, but we can't see. There you go. There you go. Now we got both.
There we go. This is from Drusilla. We are going to miss you all. We have enjoyed working with you all. We wish you the best of luck on your next ventures. From Drusilla.
Thank you, Drew. And go ahead, John.
Thank you, Mr. Chairman. I think everybody's covered a lot of the bases with the other comments, but I've certainly appreciated having the opportunity to get to know you and the 4 of you. And I do appreciate where you stood on different issues. I know Brad and I didn't agree a lot of times on things, but hey, at the end of the day, when we left the meeting, we walked out the door and we were still friends. So that's the way it should be. And I appreciate the way Evelyn Gill stood up for what she believed in, as well as Michelle. And I appreciate Hugh, what you did. I know this was a big sacrifice on your family to serve on commission and to serve your community, but you did an outstanding job, and I appreciate what you did for us as chairman. You kept us in line, and always had a quick wit about you as well. So no puns tonight, but anyways, I think you guys are on a good path. This was a good training ground for all 4 of you. And I think in the future, we'll see some big things out of you and your service to Knox County. So I really appreciate having the opportunity to get to know you. Thank you.
Yep. Thank you, John. Randy?
Yeah, I'm saving my good stuff when they show up in person.
Yeah, we'll have to do that. So, well, folks, once again, it's been a humble privilege. I'll be able to spend more time watching him because he is so much trouble. Oh,
Yeah.
so yeah. So Trace has got, he's almost an Eagle Scout. So if he gets his Eagle Scout, I'm going to see if we can get a bass boat. So I'm pushing him hard to get that Eagle Scout thing. I want it more than him. So anyhow, thank you, everybody. God bless. Go forth. We're missing Commissioner Beeler. Let's all say a prayer for him for a quick and speedy recovery. He's such a good man, and we're awfully lucky to have him here. And to all of those out there who work hard so that we can do this work, we're absolutely grateful for all of you. And seeing no other motions, I'm going to go ahead and swing the gavel here and bring this meeting to a close.